Hi, my name is Robin Littleworth, and today I'll be talking about the opioid recovery catch-22, medications that save and destroy, featuring original research conducted by me, Taylor Palma, and Jennifer Patino. Though the topic needs little introduction in today's world, I'd like to begin by quickly underscoring the devastation that the opioid crisis has caused in the United States. In the year 2023, nearly 9 million Americans were misusing opioids yearly, and over 80,000 people died each year from opioid overdose, according to the CDC. Here we are 2 years later, and the crisis is ongoing, but there are fewer yearly deaths and more people in active recovery, thanks in part to drugs like buprenorphine-naloxone, often referred to by the brand name Suboxone. This drug is a commonly prescribed treatment for opioid use disorder, or OUD. It's highly effective and largely well tolerated. Buprenorphine-naloxone is most commonly prescribed in the form of a sublingual film or a buccal tablet. A retrospective study conducted in 2022 found, with 95% confidence, that people who received buprenorphine-naloxone sublingually were about 1/3 less likely to die from an opioid overdose compared to those who didn't receive such treatment. So buprenorphine-naloxone undoubtedly saves lives, but there's a catch, and a reason why I'm talking about opioid recovery drugs in a dental setting. This life-saving drug has been shown to greatly increase incidence of rampant decay and tooth loss, among other adverse oral effects. Now, when I first saw patient accounts of their personal experiences with sublingual buprenorphine-naloxone, I was skeptical. I figured it was more likely that individuals with opioid use disorder neglect their health while in active addiction and later face the consequences of their own inaction. I wondered if science has adequately linked treatment with sublingual buprenorphine-naloxone to the dental issues faced by these patients. So I looked into the available research to find out if this drug was truly capable of what people were claiming. And after a thorough literature review, I was assured that yes, the drug itself increases the risk of dental adverse effects. One 2022 study compared the dental effects of the common sublingual and buccal formulations to the less common, less often prescribed transdermal and injectable formulations. And they found, again with 95% confidence, that those taking sublingual or buccal versions had nearly 2 times the rate of decay and tooth loss compared to the patch and intramuscular group. Even more strikingly, a 2024 statement from the FDA said that there is an evidence of a, quote, causal association between the drug in this dosage form and the adverse event. Causal, not just correlation. But what makes this drug potentially harmful to teeth? Well, I learned that primarily this comes down to the route of administration and the formulation. Since buprenorphine-naloxone is most commonly prescribed as a sublingual film or a buccal tablet, it's designed to dissolve in the oral cavity for 5 to 30 minutes. And its highly acidic composition begins impacting the dentition almost immediately. Additionally, it's known to cause hyposalivation, which significantly elevates caries risk. This led to the first phase of our original research. We designed an anonymous survey tool that would allow real Suboxone and buprenorphine-naloxone patients to share their personal experiences with the drug and their own dental health. We found that 91% of our survey respondents reported experiencing serious oral adverse effects after starting treatment. They described things like rampant decay, root canal procedures, and sometimes even multiple extractions. None of the survey respondents reported being warned of any dental adverse effects by their prescriber, their treatment provider, or any addiction specialists. And only one of our respondents received any recommendations for oral home care while using their buprenorphine-naloxone prescription. When asked about their feelings on not having been warned or prepared for the potential adverse effects of the drug, one respondent said, quote, buprenorphine-naloxone was a miracle drug for me, saved my life, but people have to be warned before they agree to be on it long term. My doctor told me there was no reason not to stay on it for the rest of my life. I would say losing all of your teeth is a pretty good reason, end quote. But patients don't have to lose all their teeth or even suffer from dental pain just because they're taking sublingual or buccal buprenorphine-naloxone for their opioid use disorder. The available literature, including from the FDA, outlines simple ways to mitigate and often prevent these sorts of adverse dental effects. But for some reason, this very important information isn't reaching patients. So we asked ourselves, are dental practitioners aware of how to help these individuals? And are the future dental hygienists of tomorrow being educated on how they will eventually help these adverse effects and what they can do to prevent such things from happening to their OUD patients? So we developed a second anonymous survey tool to gather data, and we asked dozens of practicing hygienists and soon-to-be graduates about their knowledge on the drug, its negative oral health repercussions, and the ways to prevent and mitigate these effects. We found that students and dental hygiene professionals were overwhelmingly unaware and underprepared. 67.7% of participants were unaware of the drug at all or what it was used for. 81.8% of our respondents were unaware of the adverse oral effects of sublingual or buccal buprenorphine-naloxone. And even after we educated them on the fact that the drug was dissolved under the tongue or in the cheek, 72.7% of respondents were unprepared to offer a single appropriate oral hygiene instruction or preventative measure. So it seems that the available literature, patient testimonials, and our research all point to the likelihood that patients aren't receiving this incredibly important information from their treatment providers, doctors, dental practitioners. And this is a big problem. But what if dental hygienists could be the solution to the problem, right? We're the perfect people for the job. We get to spend real time with our patients, and we get to listen to them and educate them at every single appointment. And perhaps most importantly, patients tend to trust and value their dental hygienists. Which brings me to the most important, most actionable portion of my time with you. If there's one thing that I hope you'll take away from this presentation, it's the simple steps that dental hygienists can take to make a real difference in the lives of these patients. In office, when reviewing medical histories, hygienists should ask their patients, did you take any sublingual or buccal medications? Do you take any prescriptions that dissolve in your mouth? Once the patient is in their chair, hygienists should assess intraorally for new signs of decay or new white spot lesions, new signs of hyposalivation or xerostomia, because studies show that these effects can come on quickly. Finally, hygienists should address the patient on preventative measures when educating the patient on their home care. The FDA has 3 pretty simple suggestions for what buprenorphine-naloxone patients should do after dissolving their medication. 1, they should swish with water and swallow. The FDA recommends that they don't rinse and then spit because any remaining medication that's in their gingiva or teeth should go into their system if they swallow. Second, they should avoid brushing for 1 hour after taking their medication. And third, they should use fluoride. So as an RDH, you might suggest that they get 5% sodium fluoride varnish every appointment. You might suggest that they use a 1.1% sodium fluoride prescription gel, or that they purchase an over-the-counter 0.45% stannous fluoride toothpaste. Out of the office, we can make a really big difference too. Especially as students, we often hear about interprofessional education and interprofessional collaboration, and this is an excellent opportunity for students and new hygienists to take part. We can work with prescribers or addiction counselors or MAT providers and pharmacists. And we can also make a huge impact in our own smaller communities by having discussions with our classmates and professors, or we can share this information with other hygienists, dentists, dental assistants. As for myself, I pledge to do everything in my power to prevent oral health from becoming an afterthought in their recovery journeys, because I think these patients deserve providers who endeavor to see the whole picture. Thank you so much for your time.